Dr. Barnes here, board certified psychiatrist, founder of Mindful Medicine. Today you're in for a treat. We're going to go over SSRIs. I'm going to go over every single one and kind of give you everything I know about what's clinically indicated with them, risks, benefits, everything in between. Hope you enjoy, so here we go. Right off the bat, Prozac. You got to know that Prozac is the one that's studied most in adolescents and children. Okay, so if somebody comes and they are on the younger end, we tend to default to Prozac. Remember, that's the one with the long half-life. Guys, medical students, PA students, NP students, remember on your test, choice A will be fluoxetine and choice B will be fluvoxamine. Notice how close they are. One letter makes all the difference in medicine, so you better believe that'll be choice A and choice B. Prozac is easier to come off of because of the long half-life, tends to be a little stronger than the other ones. It was the first SSRI ever made, has some indications in eating disorders, depression, anxiety, very good for OCD and similar things. But in contra to Luvox, that has the shortest half-life, this is the one that I want you to remember that is highly studied in OCD. Okay, so they all have some data, but this is the one that's highly studied in OCD. Also major depressive disorder with psychotic features, or what we used to call psychotic depression. And a couple of years ago, I read a real interesting study that was used in COVID. It was a very small study where they wanted to look at COVID rates, and it seemed to help. So look that study up and let me know in the comments. Pretty interesting. Moving on, Zoloft. This is a favorite among prescribers and people who take it alike. This is the one that had the SAD heart study, which I'll reference. So SAD heart, H-A-R-T. SAD heart study stands for Sertraline Antidepressant Heart Attack Randomized Trial. Now, mind you, this was sponsored by Pfizer, which makes Zoloft, so keep that in mind, but it was a randomized clinical trial that was double-blinded, placeboed, etc. And basically, prior to SSRIs, we were worried about treating depression in post-ACS patients, acute coronary syndrome. And if you had an MI or heart attack, we didn't know whether to give you a TCA, for example, which could cause a cardiac arrhythmia. MAOIs can cause hypertensive crisis through tyramine. So we were very concerned about how to treat cardiac patients who are also depressed. Hence, this trial came out with Zoloft, which measured a whole bunch of cardiac metrics and showed that in a statistically significant way, it did not impact cardiac functioning. So this tends to be the cardiac medication of choice and maybe a more medically friendly data in comparison to the other ones. Then Celexa. Celexa was made, it is still a very good medication for depression. Problem was at doses above 40, which there's many doses below 40 milligrams, but at doses above 40, it caused prolonged QTC syndrome, which, as you know, is an arrhythmia which could lead to Torsades de Pointes and could be lethal. So that made it fall out of favor, but what they did was they made the enantiomer, or the isomer of citalopram to S-citalopram. Okay, I always say your hands are kind of like isomers of each other is a nice way of looking at this, and we do this in pharmacology a lot. And this was marketed as the quintessential antidepressant and was supposed to be a little bit cleaner by bypassing a little bit of the first pass metabolism. It seemed to interact with medications less, but unfortunately also did cause prolonged QTC at the higher doses as well, which is why we tend to not go above doses of 20 roughly. Still very good antidepressant, very good for anxiety. People tend to feel very calm on it. Paxil. Paxil is very special. Remember, it does have the short half-life, but it may be superior in anxiety in comparison to the other ones. Generalized anxiety, panic disorder, but it also may have some slightly more baggage than some of the other ones as well. So what you're getting in return for better treatment of anxiety is you're getting potential for more weight gain, sedation, dry mouth, and sexual dysfunction, mainly because it's strongly anticholinergic. You get a lot of those side effects, but regardless, people who take Paxil tend to like it for the long run. Hope this helped. Hit me up in the comments.